Hello folks, we are currently on the floor debating the healthcare overhaul bill and its repeal. You know, I believe strongly that the healthcare system in the United States is broken and it does need to be fixed. I do not believe, though, based on what I've heard from constituents and talking to many folks in the healthcare community, that this bill does the things it needs to do. We need to make sure that healthcare is affordable, that it's accessible, and that we maintain quality of care. I believe that there are many other things that we can do that would replace elements of this bill that would actually go farther in fixing the system and drive costs down, maintain quality of care, and increase accessibility. I truly believe that we need to make sure that people cannot be denied coverage based on pre-existing conditions. I want to make sure that dependents up to the age of 26 can stay on their parents' policies. I want to make sure that we have meaningful tort reform, that insurance can be sold across state lines to expand pools to be able to bring down costs. The individual mandate, though, I believe is very, very troublesome. We need to make sure that individuals can make determinations of what's in their best interest. We also need to look at the fees and penalties that we place on small businesses. That's been very problematic, and we see that with the exceptions that have needed to be granted to companies from this particular healthcare overhaul bill. So those things I want to make sure that we are doing. We want to make sure we allow and promote choice that individuals have on their provider and how care is delivered to them. Those are critical elements of what need to happen in the overall scheme of healthcare reform. Today's bill repeal is the first step in that process, the first step in replacing those areas of the bill that we all have issues with. And as I said, I've heard from folks from one end of the district to the other. So this is really the first step in a process to try to get the best solutions to the problems with our healthcare system put out there on the table, to get them debated and to really put those measures into place. So folks, I appreciate all of your thoughts and ideas on this. This, I believe, is the first step in many to come in how we really create thoughtful and meaningful reform to our healthcare system. So thank you again for the opportunity to represent you, and may God bless you, and may God bless America.